All right, so everybody got their week 1 in front of them.
Anastasia, you want to change your top, honey.
I did.
You didn't want to represent the music Titans.
You know what? When I leave here, I gotta go and get me a drink with my friends.
Okay, so you trying to get partially ready, huh?
Gotcha.
Okay, so before we start, did anybody just have any questions where this week was kind of like when they whatever they read through was like, oh my God, I don't really understand this, or I'm gonna make sure I ask a lot of questions about this part. So did anybody run into, kind of like a train wreck during this week? Not too much.
No, it was just me. I was just being crazy on the metro part. I was like, now what am I measuring? Now I looked over to the side. I'm like, oh, it's on this side and this
Oh,
side.
that's when you said I got it. Okay.
It threw me out too.
It threw me all the way off.
It threw me out too. It took a minute, then it done on me. I was like, okay.
Okay. So a lot of things I did on purpose. So that was one of those things I did on purpose. That's one. Another thing I did on purpose was I purposely did not send a reminder until about 20 minutes before. And another thing I did on purpose, if I'm not mistaken, I think it was an answer that maybe was not in what you read, and you had to maybe Google it or search for it.
It was about 3 of them. It was.
Exactly. So that was not a mistake. That wasn't like, oh my gosh, she didn't put this in here. I didn't read it. No, you see, I told you it was on purpose.
Yeah.
And the reason I did that is because I want you to be able to exercise and use your critical thinking skills. Everything is not going to always be in front of you. It's not going to be the easy answer right here where I can flip and find it. Sometimes you're going to have to do research. So I wanted to introduce you to that, to week 1, because everybody here pretty much saying they want to go on to the next step of coding. So your answers are not always going to be cut and dry in front of you. So I want you to get into the habit of having to research, look up, or do something other than just read and answer the question. So that was on purpose. That was not a mistake. Yeah, I wasn't crazy or nothing. It was not a mistake. So another thing I did, like I said, I purposely did not remind you until 20 minutes before, because nobody's going to remind you, hey, it's class. That's why I gave you a calendar to tell you what time, what days, and all of that. As right now, actually, all 20 seats were sold for the class, and it's 3 students online. So, it all goes back to your dedication, your determination, how bad you want it, how much you're going to sacrifice. Nobody's really going to hold your hand during this process. And this medical terminology class doesn't even scratch the surface of coding. So, you're going to have to be disciplined, align yourself up. Nobody's going to hold your hand. Nobody's going to remind you. I have to remind myself daily, because I'm taking another, certification through the AFPC as well. Like, I did this, and this. I hadn't even logged in my class today. Like, nobody's going to send me an email and be like, hey, you hadn't logged in 2 days. Your assignment is due. What are you doing? So I just wanted to, give you that information as well. So the person with the highest grade, and like I was telling the first person who joined, I'm going to send you back your graded papers after the class. The person with the highest grade will receive a gift card. Looks like everybody's doing well. So the gift card that I wanted to give out, I probably can't give out a $150 gift card for one person because it looks like everybody doing good. So whatever it is, I'm going to give a gift card at the end to the person with the highest grade. And then you'll get a certificate of completion for completing this 4-week medical terminology course. So here we go. We're going to start at the beginning of the overview for the introduction for medical terminology. All of us are on the line now are kind of little familiar with medical terminology. Whether you've had a medical job in the past or you have a degree in a medical field, or just your general knowledge. So that's the good thing. Everybody really wasn't starting from scratch of the surface. And if they were, I tried to make it so self-explanatory that even if this was your first time medical terminology and learning, I tried to break it down to the easiest or simplest term. Did everybody feel like it was kind of easy or simple and I kind of explained everything well?
It was broke down pretty good. It was.
Okay, there it is. And did a lot of things kind of a light bulb make sense and be like, okay, I see you.
It did.
Okay, and what about you, Alexis and Anastasia? Did light bulbs come on with certain words?
Yeah, because a lot of them I use now.
Okay.
Yeah.
Okay.
It was for me. I still just gotta get the pronunciation. So for you to break it down how you did with sounding it out, that kind of helped me a little bit. But I need to.
Okay. Do you have a medical dictionary?
You know what? Do I?
That'll be good to have too.
Yeah,
But it's in a tote somewhere from medical assistant.
It is. If you've ever taken a medical assistant class, I'm pretty sure you got it in your little files or group of little stuff. Okay, so now we saw what the word root was. The word part that usually, but not always, indicate the part of the body involved. Did you notice how you can look at some of those words and you can automatically pick out and understand what body part they're talking about?
Mm-hmm.
Okay, so that's how you know what the word root is. So combining forms, of course, a word root that has a vowel, usually the letter O, put on the end before the addition, for the addition of another word root or a suffix. So we've already read these. We already talked about how spelling is important because you can misspell one letter and it can be a totally different word that you're spelling. So spelling is very important when it comes to medical terminology and word parts. So now we're going to go over the word parts as far as to let you know different definitions. Like algia, we see that means pain, suffering. Dis is bad, difficult, or painful. Ectomy, surgery, removal, or cutting out. That was a good one to learn, being that a lot of surgeries at the end of it is going to be ectomy, tonsillectomy, or, appendectomy or things like that. So when you see ectomy on the end, you automatically know that they're surgically removing or cutting out something. Even if you don't know what the other word means or what body part they're talking about, if you see ectomy, you automatically know it's a surgical removal. So did that make sense?
It did.
Okay. So hyper, excessive or increased. When your blood pressure is high, when you go to the doctor, the technical term is not high blood pressure. They're going to say you got hypertension. So hyper is excessive or increased. So that's an example too. Hypo. Anybody can give me, see where it says deficient or decreased or low. Can anybody give me an example for hypo?
I can't even make sure I pronounce
Something like low.
Yeah, just give me a word, a medical term that has hypo in it and tell me what it means.
Like hypothermia?
That's what I was thinking in my mind as well. That's what the word that I was going to say if I had to use the example. Hypothermia. You see what hypo means, deficient or decreased. Hypothermia means your temperature is decreased or low. So hypo, you see how it goes together. Itis, inflammation. Somebody give me an example of itis. Don't nobody say my example in my head. What you say?
Arthritis.
Okay, that's the example in my head. I guess that's the simplest one. Everybody in my head this afternoon. So arthritis. So that's how you know you have some kind of inflammation. If you see itis on the end, I don't care what the beginning is. If you see itis somewhere in that word or on the end, you know there's some kind of inflammation going on there. So ostomy, the surgical creation of an artificial opening to the body surfaces. So have you ever heard anybody heard of a colostomy bag?
Yeah, okay.
Okay, so that's what an ostomy is. You see how it says a surgical creation of an artificial opening. And if you have a colostomy bag, then you can't defecate out of your rectum. It comes into that bag. So they created a surgical opening and it's connected to their bag and it flows there. So if you see the word ostomy anywhere, like a colostomy bag or ostomy, you know that somebody created an artificial opening in that person's body to release something. Whether it's blood, waste, or whatever it is.
Would a heart murmur go in that category or no?
No, a heart murmur won't go into an ostomy.
Okay.
Plastic surgical, surgical repair. Rhinoplasty, surgical repair of your nose. So anytime you see plastic, it's some kind of surgical repair. So like hemorrhage, RHAGE, hemorrhage, bleeding, abnormal, excessive fluid discharge. So, zoom right. So anybody else want to give me any other example? Give me an example of rhea. Somebody I already know the most common. Give me the example.
Diarrhea.
Diarrhea. There it is. So you see how rhea, you see how it means flow or discharge. I forgot we got these iPhones. We can easily put it on do not disturb. Why didn't nobody remember? Okay. So diarrhea, flow or discharge. So we talked about the medical terms, or we talked about the word parts up front. So at the bottom part is the medical terms, and I just put each one of those into a term so y'all can kind of understand. You see, I broke it down and I highlighted exactly what it means. So did everything make sense right there when I put it with the word parts and the medical terms?
Yes.
Yes.
So no questions about this?
No.
Okay. So don't throw your packets away either, because this stuff that you can like keep forever, go back, refer to, and things like this. So kind of keep this, and you can always go back and refer to. Okay, so we're talking about word roots and word root and combining forms. So the first word root and combining form, well, at the top you see where we're talking about your spinal cord, your muscle, your bone, your nerves, and your joints. So all of these I'm sure make sense too. Just out of the top of my head, osteo. Sure y'all heard of osteoporosis. And it talks about your bones. So how you see that even if you've never saw the word before, if you have the basic foundation and understanding of medical terminology, you don't have to remember everything. You can just automatically look at it and know. So you know, osteo means bone. You're gonna know arthro means joint, arthritis, or anything like that. So the word root and combining forms. So the first one is gonna be cyan. So cyanosis. Anybody heard of cyanosis before? No. No? Okay. Okay. So just in layman's terms, as it says here, the blue discoloration of the skin caused by lack of adequate oxygen in the blood. Cyanosis is just like when somebody is maybe suffocating or something like that, where you can't breathe anymore. You know how your body turns a different color. We're darker skinned, so we're not gonna, you know, turn blue because we can't breathe or whatever. So most of the time you're lighter skinned or something like that. If your oxygen is somehow cut off, like if you was drowning or something like that, you can't breathe, then you're going to turn blue. So that's what cyanosis is. So leukocyte is like a white blood cell. And leuko means white and cyte means cell. So anytime, whether it's this class, when you get into coding or whatever it is, if you see leuko, you'll know leuko means white. So whatever it is they're talking about, like leukemia, you know, it deals with your white blood cells. You know, so, and you know, anemia is low. So you can automatically know that leukemia means low white cells. You know, how you can put things together. Okay, so everybody got their understanding. We won't have to read all the way through if everybody got the full understanding of what's going on. Okay, so here we talked about suffixes. We talked about how it's an adjective that describes or defines. In medical terminology, many suffixes, meaning pertaining to, are used to change the meaning of a word root into an adjective. So all of these suffixes mean pertaining to. So if you see all of these, you're going to know that this means pertaining to at the end of the word. Okay, so we got prefixes. Everybody know pre means before. So you're going to put this on before the word. So prefixes describing direction, quantity, size, and amount. That's going to be very important to you understanding the basic foundation of the medical terminology. The direction, the quantity, the size, and the amount. So you know how you see ab is away from, negative of or absent. Okay. That was my favorite one because you'll see a lot of it that says ab. And you can automatically know, like abnormal. When you see abnormal, you know, there's something negative or something going on or something like that. So a lot of these words apply to like regular everyday stuff too, to kind of figure out some things. So contrasting and confusing prefixes. So a lot of these prefixes look the same, but they are spelled different. Spelling is very, 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 very important in medical terminology. Coding, any kind of administrative work, or anything, especially when you're doing medications. If you're in this field, you already know you can miss one spelling, it can be a different medicine. So spelling is going to be very important to understand if it's a B like boy or D like dog. So I put all of these contrasting and confusing prefixes to show you a lot of the most common medical terms that get mixed up. Okay, so word parts and determining the meaning. Knowing the meaning of the word part often makes it easier to figure out the definition of an unfamiliar term. That's all I've been saying from the beginning of the class. If you know the meaning of the word parts, you're going to automatically be able to figure out what the unfamiliar term is, whether you've saw this word before in your life or not. Okay, so the example down here that I gave was, anybody want to pronounce the word? Anybody want to try? Anybody got it?
Which one we're on?
We're on taking terms apart.
Oh, okay. Woo.
Otorhinolaryngology. Ology.
Yeah, you know, that's close enough. That's close enough. And that's why I put the definitions in here so you can kind of sound it out. And it says otorhi, you know, like rhino is like the nose. Rhinolaryng, like the larynx. Laryngology.
Okay.
Otorhinolaryngology. So it's talking about your ear, your nose, your throat, and ology is the study of. So you can automatically break that down. It's like, oh, they're talking about your ears, talking about your nose, your throat, and studying. Oh, there must be a doctor that studies your ear, nose, and throat. So a lot of stuff sounded like as well. A lot of things may sound like it start with one letter, but it actually begins with another one, and there's examples. So anybody want to go through the examples? You know, a couple of examples. So it's 3 people. So 2, everybody take like 2 examples. Yeah, everybody take like 2 examples. Let's go through. And then one person to have one.
Okay. Malaise.
Okay.
Phlegm.
Gingivitis, jaundice.
Anybody know what jaundice is?
It's when you had yellow eyes, right?
Yellow eyes, yellow skin.
Or it's okay, yeah.
Do you know what part of the body, or what body part, or what organ that jaundice affects?
Is it the blood cells or
The organ. It's
the
an organ.
eyes?
It's an organ. Your eyes are an organ, but not that one.
The heart?
It's one organ. I'm gonna say, if you see anybody with yellow eyes, yellow skin, and like they say about the baby, liver, exactly.
Yeah.
If you see somebody with that, and like a lot of people who got sclerosis of the liver, who drink a lot and things like that, their eyes are yellow and things like that. So if anybody has jaundice or anything like that, you know there's automatically something wrong with their liver. Okay, so we won't have to go through all of these, but you see how it may start with an F, or it may sound, you know, it sounds like it starts with the F, but it's really a PH, or it could be a F. That's why the medical dictionary is so important, so you can kind of look up exactly what you're talking about. Okay, so look-alike, sound-alike terms and word parts. So we have ectomy, ostomy, and otomy. So those are going to be very, very, very important, especially on your next step in coding. Especially if you get a general surgery coder that you're coding for, or a physician that does a lot of procedures. So you're gonna have to know the automatic difference between ectomy, ostomy, and otomy. So of course we know ectomy means the surgical removal. The ostomy is the creation of the artificial opening, and the otomy means cutting or a surgical incision, just like we're gonna cutting too. So anybody know what a fistula is? Those 2 sound alike. So fissure, and a fistula. Anybody know what a fistula is? No. So what a fistula is, anybody know anybody who's in dialysis? Anybody knows anybody who goes to dialysis? No?
Yes.
Okay, yes. So if you know anybody that goes to dialysis, they're going to have something under their skin that connects them when they go to the dialysis, that drains their blood back and forth. And it's going to be up under their skin. It's like a tube up under your skin, and that's called a fistula. So that's how they clean your blood when you go to the dialysis center, you know, back and forth or whatever. It's the fistula underneath your skin. So let's...
So a tube in where blood goes in and out.
Right. That's what a fistula is. It's created under your skin. And you see where it says here the definition is an abnormal passage. And the reason it's abnormal because it's created. So it's a created passage, so blood can flow in and out of your body. So it's an abnormal passage, usually between two internal organs or leading from an organ to the surface of the body. And the organ that would be described in here for the dialysis would be what? What organ deals with dialysis?
The liver?
No. What did you say after liver?
Kidney?
Kidneys. That's why you do dialysis, because you have kidney failure.
Mm-hmm.
Y'all with me? I lost y'all anywhere. Everybody with me, right?
Yeah.
Okay.
Yes, we are.
Okay. So if you got dialysis, then that's an indicator that you have kidney failure. There are 5 stages to kidney failure. Now, this is going to be important. So you're going to have stage 1, 2, 3, 4, 5. And when you get to stage 5, you don't even have to say stage 5 anymore. You just say ESRD. Anybody can tell me just what you're thinking of what ESRD stand for? That's stage 5 of kidney failure. The last stage. Okay. So ESRD is end-stage renal disease. If you see the word renal, that's dealing with your kidneys. So if you see ESRD, that's going to always mean end-stage renal disease. So when you get to the end stage, you don't have to say stage 5 anymore. You can just put those acronyms, ESRD, so we know you have stage 5. So dialysis fistula deals with your kidneys. So the next word is, both of them sound just alike, ileum and ileum, but they are pronounced different and they have different, but they pronounce the same but have different meanings. The first ileum with the E is the last and longest portion of your small intestine. So in your small intestines, that's your ileum with an E. And how I remember it is, ileum is spelled with the E, and E is in the word intestine. So that's how I remember which ileum is which. So the ileum with the I is part of your hip bone. And how I remember that is it has a hip in it. So I try to do little things to help me remember, because a lot of things is hard to retain if you don't study over and over and over. So I try to come up with little acronyms or little reasons or things like that where I can kind of remember what it is. So a laceration and a lesion. What's a laceration?
A cut.
Yeah, a cut. And what would be a lesion? Okay, so a lesion grows. It's kind of like a mole. What was you going to say, Alexis?
Injury.
Okay, so a laceration is like an injury, a cut, a wound, or something like that. But a lesion is something like a mole that grows or something like that, and you don't know what's going on with it. So that's going to be described as a lesion on your skin. Lesion is a laceration is going to be like a cut, and a lesion is a pathological change of the tissue due to disease or injury. And what it can mean by injury is, just like anybody know somebody with keloid skin or anything like that, that can be classified as lesions, and that's from like sometimes injury. If you get your ears pierced, then a keloid skin will grow. If you cut yourself and how your skin is, then your injury will cause a lesion. So mucus and mucus, same pronunciation, 2 different words. The first one with the COUS describes the specialized membranes that line the body cavities. So the COUS, it deals with your cells and what's inside of your body cavity of your cells. The second one is what come out your nose. Okay, so let's see any more look-alike, sound-alike. Let's see. Allergist and Ology. So the only difference between those things, the allergist is the person. The specialist, like you're going to see the oncologist, that means you're going to see the cancer doctor. So if I say ology, that just means the study of. So oncology is the study of, and oncologist is the person that's studying. So that's the only difference between the allergist and the ology, is the person and just the thing you're studying. So let's see, the rest of it we kind of skip. Self-explanatory, supination and suppuration, infection and inflammation. Everybody know the difference between an infection and an inflammation. An infection is an invasion of the body by organisms or disease-producing organisms. And inflammation is when you're swelling up and things like that. So if you ever hear somebody, now this is going to be a term you're going to hear a lot in the medical field, especially if you work with elderly, seniors, the geriatric community. A lot of times they don't say fatigue or tired. They'll use the word malaise. Now, I don't know where it came from, you know, other than here it says it's a French origin. But I don't know why it's used a lot. You see where it says referring to feeling or general discomfort or uneasiness that is often the first indication of an infection or other disease. So a lot of times instead of it saying fatigue or tired, it's going to always usually say malaise, especially if you're dealing with somebody older. Let me see. Okay, so down here you see where your large, small intestines, your ileum, and things like that. So I wanted to give you a little view of this since we were talking about ileums. So basic medical terms to describe disease conditions. So when you hear somebody say, well, this is a sign and symptom of multiple sclerosis. So I wanted to let you know what all of these different definitions are because they're going to be very important to knowing. So a sign is an objective evidence of a disease, such as fever. How they're saying now, if you got a fever, then you probably got corona. So a sign is something that's indicating that you might have the disease. So the fever will be the sign to let us know that you might have corona. So a diagnosis is the identification of a disease. The coronavirus would be the diagnosis. Since the fever is the sign, and we think, you know, because you have a fever, you may have this disease. So the diagnosis is when the doctor is saying, this is what you have. So in coding, when you go to the doctor and the doctor writes your notes out about what you're coming in for, the doctor may write, hey, Anastasia Davis, 24-year-old female comes in coughing, sneezing, wheezing. So as a coder, the only time I will code your coughing, sneezing, and wheezing is if the doctor doesn't know what's going on with you. Because everything that's going on, 9 times out of 10, it has a diagnosis unless you got some rare disease that I ain't never heard of. If it's not a rare disease and that nobody's never heard of, it's in that diagnosis book that you'll get as a coder. So the doctor is going to diagnose you with something every time you go to the doctor and leave. So now this is something to be aware of too, now that you're getting deep inside of this field. Because now that I'm in this field, when I go to the doctor myself, I want to see what you're coding. Because all of these things goes into my medical history. And when you think about medical history, when you're trying to get life insurance or any kind of other insurance, when they want to know your medical history, they're going to pull your records from the doctor. So, you know, start paying attention. Don't just let the doctor see you, write their notes, and, okay, we'll see you, Miss Davis, in 3 weeks. I want to know what you coded it as. What diagnosis or what disease did you put that I have? So, no, I'm in class. No. So, every time you go to the doctor, there's going to be a diagnosis that they're going to diagnose you with. You're not going to leave out there and if you go in for left hip pain, you're not going to, if you go in there for left hip pain, you're not going to come out and they're going to say, oh, I saw her today, she had left hip pain. They're going to diagnose you with something. So start paying attention what's on your medical record that they're diagnosing you with, because that's going to follow you. Always. Because you can dispute it and you can be like, no, I just came in for a fever, but I don't have corona. You know, they've been messed around and I'm going to tell you one thing that I've been seeing lately, because I have to code a lot of corona charts. Now, undoubtedly, the corona is real. I'm not saying it's fake. It's definitely real, you know. But the thing that's funny about it, and I couldn't put my finger on it at first, and what's funny about it, if I read a patient's chart, and if they have fever or whatever else, I have to code it as corona, even though their test isn't back yet. So they're displaying all of these signs as corona, but if their test isn't back yet, I don't want to code it as corona, because that's just making it another confirmed case, and you might just got the regular flu. Or you might just got a virus from your son or something like that. But just what's going on now, if you have all these signs and symptoms, and if you've been around somebody, then I automatically have to code it as corona. You know, so.
Wow. So are they getting paid more for their code or something? Okay. Okay.
You know, so a lot of things in the healthcare field, that's why I was, you know, really pushing it, because a lot of things in the healthcare field is about money. That's why it's never going out of style. That's why it's going to always be in demand, because you can't think of any other field other than technology and computers that's getting the same money, if not more, is medical care. Only two: technology and medical care. You know, because anything can pretty much fall up under their umbrella. So with this COVID and all this and every other thing, it's a lot of money in healthcare. So diagnosis. So think about it. Every time you go to the doctor, anything wrong with you, they're going to give you a diagnosis. So ask them, what are you diagnosing me with? So you can know what codes are going on your medical claims. Okay. So an acute, the next word is acute. An acute condition has a rapid onset, a severe course, and a relatively short duration. So anytime you see the word acute, that means it came out of nowhere and it probably won't last long. So the opposite of those words, okay, I got it down here, is going to be acute, and then on the other end of the spectrum is going to be chronic. So if somebody has a chronic health condition, that means they're going to have that for a while, over a long period of time. They've already had it. So if somebody have an acute situation, that means it happened real quick, and it's probably going to be gone once we get it fixed. A disease. A disease is a condition in which one or more body parts are not functioning normally. We all know what a disease is. Symptom, we just talked about it. Symptoms are things that let you know that something is wrong. If you got a fever, if you got a cough, if you got a headache, you know, if your hip is hurting. So a symptom is letting you know that something is wrong. A differential diagnosis, also known as a rule out, is an attempt to determine which of the several possible diseases is causing the signs and symptoms that are present. So if you're having signs and symptoms, but it could be 5 different diseases that have these same symptoms and signs. So that's what a differential diagnosis is. That's them trying to rule out what it's not. So if you ever see or hear a differential diagnosis, they're trying to figure out what's wrong with you, because the symptoms and signs you're having could be symptoms and signs of 20 different diseases. So now they're trying to rule out what you have. So we talked about chronic. We're saying that's a condition of long duration. Although such diseases can be controlled, they are rarely cured. So acute, like I said, is happen quick. We can get you fixed up and we can get you on your way. Chronic is rarely going to, like if you have heart failure or heart disease, that's a chronic condition, because once your heart goes bad, it doesn't repair itself. So anytime you have a heart condition or heart disease, that's automatically a chronic condition. If you have kidney problems, that's chronic, because the only time usually you can get your kidneys fixed if you get a transplant and get a new one. Like once it fails, it fails. Liver, any kind of liver issues that you have. Now sometimes it can be acute. And acute mean like today I'm doing fine, tomorrow I woke up, I went to the doctor, my liver test was low or something like that. They saw what I needed, gave me some medicines, now my liver levels are back high. That's acute. Okay. Eponym. It's a disease, structure, operation, or procedure named for that person who discovered or described it first. For example, Alzheimer's disease is named for German neurologist Alois Alzheimer's. And a lot of times when you see these names for these diseases, that's what it is. It's named after whoever found it, whoever had it, or whoever described it first. So a syndrome, a set of signs and symptoms that occur together as a part of a specific disease process. Like Down syndrome. If you have the extra chromosome, then you're going to have Down syndrome. So that's when together as a part of a specific disease that you have certain signs and symptoms. And the signs and symptoms of Down syndrome, even if you don't do the chromosome test, all Down syndrome kids look alike. Whether you white, black, Asian, whatever it is, all Down syndrome kids, you can tell they have Down syndrome. Would y'all agree?
Yeah.
Okay. So a prognosis. Yeah. So a prognosis is a prediction of the probable course and outcome of a disease. So a prognosis means if you come in and you tell me you got, I run a test and I see that you got HIV. So if I give you a prognosis, that's me saying in 6 months, it's so bad in 6 months, then we're going to put you on hospice and it's going to be any day that you won't be, you won't live. So that's what your prognosis is, when they kind of predict what's going to go on with you over a period of time, where they give you a year prognosis or for the next 3 months. So that's when they're predicting what your health condition is going to be. So a remission. Anybody heard of remission? Of course, they say my cancer is in remission. Okay.
Yeah.
So it's a temporary or partial or complete disappearance of the symptoms of a disease without achieving a cure. So of course, we don't know, or we haven't heard of any cure for cancer. So we can't say that when the cancer goes away, we can't say, oh, she doesn't have cancer anymore, or she won't ever get it anymore, because it's not a cure. So that's why they won't say she's cured of cancer or whatever. That's why they say, oh, she's in remission. Because since it's not a cure for this specific disease, we don't know if it's going to come back or not. So if we don't know if it's not going to come back, we can't say you're cured or we lied. So that's why we have to say it's in remission. It's gone now. We don't see it now, but I can't say it will or won't come back. So using abbreviations. Acronym. Oh, here you go. Acronym. I'm sorry. Acronym is the word.
Use abbreviations.
Okay. Well, I guess it would make sense because you're only dealing with one body part, really the mouth or the teeth or anything like. So it ain't.
Exactly.
So I guess it ain't too many things you can mix up if you're dealing with just one area.
Exactly.
Okay. So these are examples of do not use abbreviations. You see where MS here can mean morphine sulfate or either magnesium sulfate. So think about if a person needs some magnesium because they having some digestive issues, and you put MS and they give them some morphine, and all they needed was some stuff for the bathroom. You done gave them some stuff that's gonna knock them out, you know. So you have to be careful with those abbreviations. Like she said here is QD, meaning every day, and QOD meaning every other day. So that can be confusing as well. And I also slipped a list in here of anatomy and physiology prefix and suffix list. So we got to the end, and we have it here. So I guess we can go over it as well. Let me grab papers. Okay. So you can just highlight the answers, or whoever do it first or whatever. So for bad, difficult, or painful, which one is gonna be?
This.
Okay, there we go. For excessive or increased.
Hyper.
Here.
Hyper.
You can't hear?
Hyper.
I see it now.
Okay, okay. Enlargement.
Mega.
Mega.
Okay. So, okay, somebody give me an example of mega means large. It don't have to be a medical term. It can be a regular word term, but it has mega in it.
Oh. Mega on a daily.
Okay, so megaphone is just a big phone. Everybody heard of megaphone before?
Yeah.
Okay, so it's a large phone, like you speaking in a megaphone. So, you know, so that's why I said these medical terms can also apply to everyday life if you knowing what the root of it is. So pain and suffering, which one gonna be pain and suffering? Okay. Surgical removal.
Ectomy.
Okay, somebody give me a example of ectomy.
Hysterectomy.
Okay, and what are you removing?
How long the women get the hysterectomy? Okay.
Uh-huh.
Okay. Or vasectomy.
Right.
What are you removing?
Ovaries.
When you get a hysterectomy, you can get a partial hysterectomy, and you can get a total hysterectomy. So if you get a total hysterectomy, you're removing all of your reproductive part, ovaries, uterus, fallopian tubes, everything when you get a total hysterectomy. When you get a partial hysterectomy, you might be just getting your ovaries removed, or you might just get your fallopian tubes removed. So a total hysterectomy is when you remove the uterus and everything in it. So that was a great example. Hysterectomy. That was a great example. So okay, next, abnormal condition. Anybody want to go on an abnormal condition?
What'd you say?
What's the
volume.
the answer for abnormal condition?
Osis.
Osis, okay. Abnormal softening.
Malaise.
Malaise. Oh, Malcia. I'm sorry. I'm thinking about malaise. You were exactly right. Malcia. You're exactly right. I'm thinking about malaise. Okay, deficient or decreased.
Hypo.
Okay, another example besides hypothermia.
Hypoglycemia.
Okay, and so what's low? If I got hypoglycemia, what's low?
Hold on.
Hypo.
That's good. What's low? If I got hypoglycemia, what's low?
Your blood sugar.
My blood sugar. There it is. That's why I get the finger stick. There you go. Now y'all know all these old folks in our family that we have to check their blood sugar. They got but you know what? We don't say hypoglycemia. We gonna say your blood sugar low or high. You know, it ain't no girl. Look, that's how you know. Look, we so magical. We just create stuff. Blood sugar. You know what I'm saying? It's your hypoglycemia or hyper. We just say blood sugar, and that's what it is. Okay, tissue death. What would that be? What answer is that?
Itis. Is it itis?
No, inflammation is itis. We ain't do that one.
Oh, okay. I'm sorry. Okay, so inflammation, itis. Yep. We talked about arthritis. So tissue death. What would that be?
Necrosis.
Necrosis. Exactly. When you if you die and they need to get some tissue from you to test it or something like that, they'll call it a necropsy. So you know how all of them kind of have the little same beginning definitions. So visual examination, what would that be? Scopy. Okay, so give me an example of scopy. Okay, so I'm gonna say endoscopy. So like anybody heard of Dr. Bowden? Y'all heard Dr. Bowden?
Mm-hmm.
Okay, so he's an endo doctor, you know, and things like that. So if he's gonna do an endoscopy, he's probably gonna put a tube down and look at your endo system and things like that. So endoscopy is a good one. So rupture, what would that one be?
Rices?
Or you can say, people say rices or rexes, or you know, it depends on how you ever want to pronounce it.
Rexes.
So abnormal hardening.
Sclerosis.
Okay.
Sclerosis.
Okay, anybody know example of sclerosis? The easy one, everybody come to everybody mind.
What?
Sclerosis, no bad. Multiple sclerosis.
Yeah.
Now everybody want to say yeah. Everybody, where would
I don't know what I'm thinking about over here.
So multiple sclerosis, of course.
Osteoporosis, though. That's what I'm finna say. Then I had to go back and look at my paper.
No, we ain't talking about no porosis, man. We sclerosis. And so multiple sclerosis, as we said, is abnormal hardening. That's why when people with multiple sclerosis, they can't walk or move or their face is stuck because it's abnormal hardening of your muscles and things like that. So multiple sclerosis is a good example for that. Abnormal narrowing.
Stenosis.
Yep.
Stenosis.
Mm-hmm. And you will hear people talking a lot about stenosis when it comes to their heart or cardiology and things like that. So flow or discharge.
Rhea.
Okay.
Yeah.
And I'm sure everybody's had diarrhea before or anything like that. So that's the prime example. So the medical term for high blood pressure would be what?
Hypertension.
So what would be low blood pressure?
Hypo.
Hypotension. Okay, the term blank means pertaining to birth.
Prenatal.
And you see how that, you know how your terms mean something like natal means birth and pre means before. So even if you've never saw the word prenatal, if you know your medical terminology, if you see prenatal, you know pre is before and natal is birth. So you'll know, man, it's probably pertaining to before you the birth or something. So, you know, common sense. Pain is classified as a what?
Symptom.
Symptom.
It ain't no sign?
Yeah.
It can be a sign. I was confused on that.
It can be a
Sign or a symptom. Yeah, I was confused on that one though.
Okay. So a lot of times things can be confusing. But the thing is, a sign is telling you this is what you have. And just because you have pain, I don't know what you have. You see, when usually signs are, this is what you have. Symptom is, this is what you possibly could. So you guys are right. This was the right answer. I just want to play with you right fast. But a pain is classified as a symptom. So everybody was right. So the medical term blank means described as inflammation of the stomach.
Gastritis.
Gastritis. Gastritis. And that itis helps you to know that it's inflammation. So the formation of pus is called what?
Suppuration.
Suppuration. Exactly. A fever is considered to be a what?
Sign.
Okay, there you go. So everybody got it right. So it couldn't be too tricky. Everybody got it right. So that is week 1 that we got handled down. So anybody have any questions about week 1? Did you feel like you learned anything you didn't, or how do you feel about week 1, everybody?
I'm excited. I don't know if it's just me, but I'm excited.
Okay.
I'm excited.
Yeah. I learned some things.
Yeah. And then I'm gonna share some. Yesterday when I finished my assignment, my son, he was like, "Mom, did?" I'm like, "Exactly." Like even he like rooting for me. So
Okay. Well, there it is then. Have anybody started looking over week 2? Or I'm going too fast?
Nah, not yet.
Okay.
I'm looking a little
We'll
bit.
start on tomorrow, on Sunday.
I'm a procrastinator, so.
Okay, so that means you work good under pressure in the last minute.
Mm-hmm.
Okay, so now I'm gonna send you week 3 and 4 assignments this week, and week 3 and 4 is kind of skipped over all over the place, where I feel like kind of what's important, you know, that you're gonna really need to know for the next step, since it's only a 4-week and cramming everything in 4 weeks. So the basic foundation is week 1 and 2. So with everything you're gonna learn in week 1 and 2, that's the basic foundation you're gonna need, period. Whether you go into coding, whether you do billing, whether you do anything else in the healthcare field. So like I said, weeks 3 and 4 is gonna be skipped all over the place. It's not gonna, you see how today we talked about the word root and the root words and the things like that. So week 3 and 4, just so you understand, it's gonna be skipped all over the place to make sure I cover everything you need to know in this short period. So any other questions or anything like that? Nope. Okay. So I will see you guys on next Saturday. It actually did take an hour. I thought maybe it was gonna take longer than that. That's why I said to 2 o'clock just in case it did.
But everybody made 100. Everybody made 100 this first round.
I don't know. Everybody didn't. No, everybody didn't make no 100, but everybody did good. And I'm gonna tell you what everybody. I'm gonna tell you on the questions where you had to look and find the answer is like they probably like, I don't know what's going on. You know what I'm saying? I didn't read this. She didn't put this in here. Maybe she made a mistake or something. So I guess I'm gonna make a mistake with her too. You know, so I guess that's what there was. But everybody did do
Not to
real
make no
good.
mistakes, but I did when I started doing. I was like, hold on now. She said go in the notes so we can scan it on through. Did my work get sent, or do I need a fax number?
Yeah, I'm sure was like, I hope I'm sending this the right way.
Yeah, however you wanted to, whether you just wanted to, you know, because some people, you know, some people sent it to me like this, where it just got 1, 2, 3, 4 with the answers, and some people filled it out and scanned it to me or whatever. So with it, just as long as I had the answers, and so I can go over, you know, whatever that's best for you. I ain't gonna have no methodical, disciplined method that it has to be on white paper with blue trimming with the number at the bottom. You know, none of that. So as long as you turn it in, it's legible. I can read the answers, or you scanned it or whatever. Just no pictures to my cell phone. You know, I had to just tell people, now we ain't gonna do the pictures to the cell phone. You got to turn it into the email so I can print it out and grade it back and do all that. So I'm glad everybody learned a lot of stuff week 1. you feel like it was fulfilling for you. So please, you know, if you if we had these sessions or if you read the courses and you feel like it's something that I could incorporate to help, you know, do the class better or the Zoom better, whatever it is, just I'm always open to your, you know, y'all ideas of what can make the class better. So if it's nothing else, I'll see you on next Saturday at the same. Okay, yes.
So will you be sending the assignments for back to us, or how will you do that?
Yeah, I'm gonna send it back to you with your grade on it. I'm gonna send it back to you
Gotcha.
with your grade on it.
Alrighty.
Okay, well, I will see you guys next Saturday, 12 o'clock.
Alrighty.
See you,
I just got
Alexis.
one more question, 'cause
Okay.
I don't know what's going on. I was doing Zoom on my iPad. Now it's on my phone. And I am just all over the place. So when you ladies signed up for Zoom, did you just do like this whole shebang, your name, your email, a password? What did you do? Because at first I was just clicking on it and my email and everything would come up. Now I just don't know what it's doing.
I think I created an account, if I'm not mistaken, because it had my name when I just had to put the meeting ID number
Right.
and everything. That's just
That's
pretty
what
much.
I did first. Okay, well.
Because at first it had iPad on there for you, but now it just say guest. So you might have just put the meeting number at first and your stuff was already logged in, and when you did it the second time, I don't know, maybe you had an account and you didn't know it or something. I don't know.
I'm always doing something. Okay, that's my
Okay, anybody else? Any more questions before we go?
Everybody have a good
Were
week.
you still gonna send the mass email with everybody email?
Yes, I'm still going to send a mass email for everybody's email. I'll do that. Let me write this here so everybody can have each other's emails. Mass email today. I'll send it as soon as we get off the call. So, okay, so everybody, you know, want to form their own study groups or help or do whatever. Okay, what was you about to say?
I was just gonna say, I have a lot of work in my iPad. Some of it could be beneficial, some
Okay.
may not, but I'll send to everyone. I don't mind.
Okay, yeah.
Okay, I'm all for it.
Right. Even me too. I'm all for it too. You might got some stuff over there that I might possibly need. So I'm pretty sure nobody's gonna mind you sending them some you know, some helpful stuff to the email. So I definitely would do it. So I'm gonna send a mass email with everybody's email on it today. So you'll have everybody's email if you wanna you know, just be nice to all of us and send it, pass that around. Okay, so if not, I will see everybody on next Saturday at 12 o'clock. I might send an email, might not. I'm pretty sure y'all gonna remember because y'all remember this Saturday, huh?
Yes.
Were y'all looking forward to it?
Yes, I was.
Okay. Well, I will see, and I'm gonna get this, edit this tape, and send it to the rest of the people who didn't, who couldn't attend or whatever the case. And I'll see y'all on next Saturday. If you have any questions in between, shoot me an email or whatever the case, and I'll return your email within 24 hours.
Okay.
Okay. All right. Y'all have a good Saturday, everybody. Kids included too. Look, I heard somebody cheering back there, so kids included. Let me get mine and poke mine in the eye and everything, trying to tell him to go in there. So let me look right. So let me get him.
I told my son I've been doing this and had my head turned. I'm still paying attention though.
Look, let us get back.
My baby sleep.
I was just gonna say you the only one with the good baby, and she don't have no baby. So I guess me and Alexis, we the only one with the problems this year. We gotta go tend our problems.
So this just the second weekend. So let's see how the rest of this go. Okay.
Okay. See y'all next week.
All right.
Bye.
Have a good one.
You too.
Bye-bye.
Bye. Your first step is you're going to want to save your money. Don't get any Amazon packages to your front door. Buy any unnecessary clothes or shopping, or, you know, you want to start putting your money into the bank. Put it under the mattress. Give it to your trusty best friend, your favorite cousin, your parents. Start saving your money. And then you want to take a visit to the new city where you want to move to, just to make sure your family likes it as well. If you have family that's moving with you and not relocating by yourself. Then you're going to want to take a look at apartments and homes and things like that once you're there, to kind of look around the city, to kind of see if you're, you know, what parts of the city you would like to stay in, just explore, walk around, drive around, things like that. Kind of get familiar with the place so when you actually do move there, it won't be so unfamiliar to you that you've never been around, you don't know where anything else is or anything like that. And then when you're there, you want to look for schools or daycares or things like that if you have kids. Everything won't be virtual forever, so do that. Then you want to go and start putting in resumes to different jobs and things like that. Put in your resumes, get on LinkedIn, get on Indeed, Monster, all of those things. And then wait for your call. They're going to eventually call you back if you start putting your resume in enough. So once you get your call back, then guess what? It's going to be interview time. So you're going to go to the interview, and you know what you're going to do? You're going to ace the interview. So once you ace the interview, then when you get back home, they're going to be calling you back. They're going to say, we loved you. The interview went great. And then once they tell you all of those things, the next step is, guess what? You're hired. They're going to say, we want you. And then you're going to tell them, yes, give me the job. And then you're going to give them about a 3-week window and tell them that you're going to move in about 3 weeks. And they'll give you enough time to kind of take care of the things you need to take care of. And then you're going to start getting on your computer and on your phone and tying up your loose ends and ending your leases. Most people let you out your lease if you have a job offer out of town. Then guess what? You're going to start packing. Start packing all of your stuff, whether you have to pack for your family or pack for yourself. Just start packing your clothes. I'll probably take about a week or so to kind of pack everything up and tie up my loose ends and things like that. And then once you do that, once you've got everything packed up, this is probably going to be about day 6 or day 7 or things like that. Then you're going to get on the computer again before you leave and start looking for apartments and hotels and things like that in the area of your new job. You're going to pack your U-Haul up. You're going to get in your U-Haul, and then you're going to head out. It's time to go. Don't say it's moving too fast, because this is what you asked for. So you're going to pack you and your family up, or you're going to go alone, and you're going to travel to your new city. Are you ready? Once you get there, just drive around by the hotel, that you're going to be by, because you're going to look that up before you get there. And then you find schools in the area of the hotel. Then you're going to go back to your hotel, because you've been traveling, you've been packing, you've been mentally exhausted from your move, and it's time to get some rest. So you're going to get you some rest if you're by yourself, and just relax your mind, just wrap your mind around everything, that you're really there, you really did it. If you have kids, then it's time for the kids to get the rest. They've been traveling with you, so they're tired as well. So the kid's going to get rest. And then you're going to get up and talk with them and tell them about your new journey, or you guys' new journey, and what the next step is going to be, so they can kind of understand and be in the loop of what's going on. And then you're going to look for schools. Go ahead and enroll them into schools if you have kids to go with you. Most people have kids. That's why I incorporated. So you're going to enroll them in school. And then you're going to start preparing for your new job. Ironing your clothes, mentally preparing, just doing everything that you need to do to kind of get ready. By this time, you should be on around day like 15 to 21 to kind of prepare for things. Then you're starting your new job. So this is how to relocate in less than 5 minutes. I hope you enjoy.